this is Dr. Benzinger on Health with secondopinion.org. Today we're covering B6. B6 is important because, frankly, carpal tunnel syndrome, tennis elbows, tendinitis, and lots of other issues. B6 is an important nutrient that, frankly, is rearing its head in this society in a big way. First thing that we always cover, natural form versus synthetic form, so that you know the best forms to buy and some of the cheaper forms that unfortunately most of the public are being given. Natural form is Pyridoxine 5-phosphate. Again, you should just be able to read it, and remember, you can watch this over and over until you get this down. Pyridoxine is easier to absorb for some people. Here's the whole point. In this natural form, if you are a pretty healthy person, you probably won't have so much problem with the synthetic form. But if you're not, and I'm not talking about sickly in bed, I'm just talking about if you're run down, tired, exhausted, and you need a boost, you need that natural form because it's more easily going to be absorbed. It has what they call the synergistic elements to be able to allow you to be healthy, and that's what we want for you. Now the synthetic forms, which are going to be the most common thing you're going to see, pyridoxine, okay, in something called the hydrochloride form, okay, or mononitrate. Again, mononitrate or hydrochloride form, and its commercial name is cyanocobalamin, okay, or cyanocobalamin. Cobalamin is probably the best way to say it, but I've heard it both ways, so I'm going to say it to you that way also, okay? Just so that we clearly understand what a vitamin is an organic substance that is vital for life. It has to be there every day. You want it there every day for optimal health. Synthesis cannot be synthesized in the body, and thus the diet or supplementation must add it to your body every day, okay? It's a water-soluble vitamin in this case, such as other B vitamins and vitamin C, is really safe for you to take. How does just the idea of synthetic comparison to natural look in the body, or look to the body might be a better way of saying it. If you'll see this picture, I'm just picking ascorbic acid because it's a nice picture here. If you look at the top, it says ascorbic acid. How many of us think that vitamin C is purely ascorbic acid? It's not. Natural, real vitamin C, look at the color difference. It's drastically different. Reason why? Nutrient devoid on the top, nutrient filled on the bottom. The natural vitamin C, much healthier, easier for your body to identify and utilize because it has everything it needs for your body. Well, the same thing's true for B6, pyridoxine, okay? Most forms of vitamins are processed out of natural forms. It is very important to take this nutrient with other synergistic nutrients. In other words, those things that help it work efficiently, because it works the best that way. Without the synergistic nutrients included, you use your body's reserves and may create a deficiency in another nutrient while you're trying to do something good. So just follow this. Synergistically, we want potassium, B complex, and vitamin C together if we're looking for B6 to be the most efficient. Remember, the 2 points of view is if we get it in a highly synthesized form, you have to supply these other synergistic elements, or otherwise, guess what happens? You end up burning these out while you're dosing on your B6. See, some people will say, you know, I took it for about 2-3 months, and I really thought it was helping, but then it just didn't seem to help anymore. Guess what you did? You burned out the synergistic nutrients, and it mimics B6 deficiency again in a different manner because you're missing one of those elements. Think your body is this assembly line of all kinds of things that have to be put together, and if you're missing one of those key components, you're producing cars with no doors or no paint or no wheels or whatever. They're really not whole cars, are they? In fact, they usually will stop on the assembly line until they get the parts to be able to do so. Finish the job. Well, the body does the exact same thing, or tries to replace with, instead of blue paint, it's a red paint with blue stripes. It doesn't look quite right, does it? We want the whole thing. If you look at like a broccoli is a good indicator of, oh, look at all the elements that are in there. Well, guess what? Most of the nutrients that we want are inside broccoli. They're even more so in an apple. Here's the whole thing. If you think you're going to take this pill, B6, pyridoxine, it's going to satisfy your need without eating good fruits and vegetables in a raw form or at least lightly steamed form, you are sorely mistaken. Sorely mistaken. You are not going to get enough in your body, and it's going to be a problem. And vegetarians, this is a really key issue for you. Okay? In the body, what does it do? It's involved in metabolism of almost all proteins. Proteins, cancer, real tight fit, got to have it, especially something called tryptophan and other sulfur-containing proteins. Why is tryptophan so important, or tryptophan? Tryptophan is the precursor to serotonin and melatonin. Serotonin is what antidepressants are supposed to help. So depressed people, kind of angry people, upset all the time, down a lot, maybe B6 is a component because they don't get the tryptophan to work to get serotonin, melatonin. Poor sleep, can't get to sleep, can't stay to sleep, no deep sleep, very superficial type of a sleeper, except for when you have babies the first 2 years, you're always going to be superficial sleeper, but you just can't get into deep REMs of sleep. B6 might be a component to that, okay? Important for proper functioning nervous system. It's important in breaking down collagen, okay? Those things that many times can become fat, collagen, needs B6 or otherwise your energy won't stay up. It helps prevent arteriosclerosis. That's a big deal. Benefits treatment for allergies, arthritis, asthma. Big deal. Remember, B6 is highly deficient throughout our society from the information I have been given and read over the years. Don't be misled. If you don't have our seminar on secrets to vital health, that will clearly give you an idea of where we stand today, no matter who's trying to sell you a bill or whatever. We are having problems with this nutrient and you need help with it, and at least it's a safe one. The other things it helps is it can help oxalic kidney stones necessary for production of hydrochloric acid. So stomach might need it, and preventing stones, B6, might be one of those things. If you've had them before, you might want to start supplementing and try to assist, okay? Other deficiencies, carpal tunnel syndrome, depression, confusion, abnormal brain waves, following convulsions, epileptic seizures might be related, patches of itchy and scaly skin such as eczema or seborrhea, vomiting, low blood sugar, headaches, flaky skin, cracks on the side of the mouth, and fatigue. Sources, shellfish. Some of you are highly allergic to shellfish. That might not be your source. Cabbage, carrots, chicken, fish, meat, eggs, and peas. Good source. And again, you notice a lot of this protein, fish, meat, eggs, chicken, vegetarians, if you're not very careful, this will be a deficient area for you. And elderly, we know there's significant deficiencies in that area throughout the country. Athletes, heavy alcohol drinkers, pregnancy and nursing, seems to just drain out of your system, ladies, and heavy smokers. Okay? Toxicity, there have some reports of neurologic conditions over large doses over a long period of time. So unless you're ridiculous, it's hard to get B6 toxicity. Okay? Absorption is blocked by cortisone diuretics. It's impaired by thyroid dysfunction, air and seasickness for some reason, temporary problems, but it can happen. But in medications, it goes on and on and on. I'm going to cover some. You need to get a book and look at it, because if you're on medication, you need to know what nutrients your medication is inducing in deficiencies, so you don't have other symptoms from a necessary element that must be part of your diet every day, because your medications are burning it out, stopping absorption, or creating problems. Medications interfere with good nutrition on a frequent basis. Well documented. Phenobarbitals, antidepressants, oral contraception. We know it's all the B vitamins. Oral contraceptions are a big issue, and we got ladies that have been doing it for 15 years. It's big. Large amounts of meat, eggs, milk, and alcohol, just a glutton basically. Dilantin, levodopa. So we got Parkinson's disease patients. They're going to advance B6 deficiencies. B6 doesn't interfere with these medications as much as vice versa, unless you're taking extremely large doses. Okay? Antibiotics and antivirals of most types, prednisone, cortisones, many other drugs. You might want to pull in the Essentials Herb Drug Vitamin Interaction Guidebook, because that's probably one of the better books on this out there right now. It's destroyed by water, boiling of water, canned foods, long storage, stewing and roasting of meats. Over if it gets too soft, many times the B6 is burned out of it. So we know it's depleted by antidepressants, estrogen therapies, oral contraceptives, and large amounts of meat and alcohol and things like that. Here's the recommended RDAs. And if you, again, didn't get our seminar on secondopinion.org of Secrets to Vital Health, you should. Optimal health is not maintained by this dose. This is just the recommendation for keeping you alive. Men, 2.2 milligram, women, 2.0 milligram. Let's see here. When we talk about the advanced possibilities of benefit of B6, Dr. Benzinger's advanced knowledge. Pyridoxine can benefit the nervous system in multiple areas. B6 is necessary for the production of serotonin, so we've talked about that. So depressed patients really should look at this, okay? Carpal tunnel syndrome. We've had well documented, and I've even got some of the family docs that are looking at it, but combine riboflavin, B2 with it, and it's more efficient. Carpal tunnel with B6 and B2, more efficient. Childhood epilepsy has shown some promise with B6. And infant formulas have been documented for years to be low on B6, and you should talk to your pediatrician in that area. Cardiovascular, required for all healthy blood and blood vessel production. Okay? It's needed to convert iron into the red blood cell, so iron deficiency anemia problems can be B6. Also can be B2 again. The effects it has a negative effect on the autoimmune system if you don't have enough B6. And it helps lower homocysteine, which lowers heart disease. Homocysteine's been shown to really create, if it's too high, heart problems as well as osteoporosis and a few other areas. So B6 is really important for that. And multiple advantages exist beyond that frankly it just goes on and on. B6 is really important. You need to do this. Women's health issues. It may help greatly the ill effects of PMS, such as depression, irritability, fatigue. You might take larger doses temporarily for a week or so to get you through that and then come back off them. Because remember, it takes large doses over a long period of time to create a problem unless you have a unique scenario. Very few have that unique scenario, okay? And I'm trying to tell you things that I can trust are pretty safe. Several studies have shown that women on oral contraceptives have constantly lower B6, and it can affect you. And pregnant women often do not get enough, even in that prenatal vitamin, mostly if you've got a few other bad dietary habits. You eat whatever you want to eat. Well, guess what? If it's not healthy, you probably need that extra B6. The adrenal gland secretes a hormone called corticosteroids, glucocorticosteroids, and they help to reduce inflammation or swelling in the body, and B6 helps that a lot. Night vision, better vision, night vision, and helpful for some vision disorders is also a consideration also, okay? So B6, an important nutrient, very important nutrient, something that you really should look into. Safe? Very safe. We hope you look into this seminar as well as other ones so we can get you educated. Hopefully you've registered at secondopinion.org, secondopinion.org for our free newsletter. It'll be right there next to my picture. Just put in your address and you'll get something every week to know what's out there. We don't sell you anything on those emails. We send you information so you can start helping yourself and others, okay? Our whole goal is to teach you how to, in a conservative way, start helping your own health, making a difference in the best way possible. We hope you've enjoyed today's session. This is Dr. Benzinger on Health with secondopinion.org. We'll look for you next time, and may God bless you.